to ask that people do the raise hand, and then I'll moderate and ask. If we have too many hands raised, then we may go to sort of, I might go to asking people just to put their questions in the chat, and I can try to synthesize some of them if they're similar. Just really briefly, I don't want to take too much time, but the purpose and the goals of this collaboration between the Leong Centre and Statistics Canada really stem from the fact that as many of you know, the Leong Centre is very interested in child health equity, and one of our pillars is data. And facilitating people using data. Statistics Canada has just a wealth of data from so many different sectors that really touch upon child health equity. And, I would say, so personally, I think they're actually underutilized in child health research. The other thing is that there's a lot of work that comes out of Statistics Canada on child health, really amazing work. And so we really wanted to start building a bit of a collaboration, hoping to catalyze work, educating Leong Centre members about the data that are there, but actually really also a bit more bi-directional, learning what Statistics Canada is doing, in the space of child health, and hopefully, catalyzing some collaborations. So we are going to have a speaker series where we'll alternate between speakers from Statistics Canada and then speakers from the Leong Centre, and very happy that the next speaker will be Petros, who's a scientist with the SickKids RI, and Chess, who's been doing really interesting work on preterm birth, linking health data with income, educational data, and labor force data. One final thing before I go into introductions as well, we are really interested to understand what people's needs might be in terms of using and accessing Statistics Canada data. So there was a link in the calendar invitation for a really short survey that could help guide us in terms of what we as the Leong Centre could do to sort of facilitate that. And Antonio's just put in the message in the chat box a link to it. So would really appreciate if people could fill that out. And so then I'm going to first introduce Leanne Finley and Daphne Cohn. So they're the two leads with whom Eyal, Antonia, and I have been working to sort of really start to build this partnership. So Dr. Cohn is an assistant director at the Health Analysis Division at StatCan. She's also an adjunct professor in the Department of Epidemiology and Community Medicine at the University of Ottawa. And Dr. Finley is the chief of the Child Health Section in the Health Analysis Division at StatCan. They're both trained as developmental psychologists. Their research areas include use of secondary data for policy research related to child development and vulnerable populations. And their work includes research using a vast array of types of data, including survey, administrative, and linked data to answer policy relevant questions. I will then turn it over to them, and they're just going to provide a bit of context around the work StatCan is doing around linkages to researchers, the history of some of the surveys, and the applicability to children as well as to equity research before we move into the meat of it. And I'll introduce Maha Clarke before that. So pass it on to you, Leanne and Daphne.
Okay, thank you so much for the introduction and for welcoming us. It's really exciting. We've been talking about doing these series of presentations over the last few months, and just to have it actually happen is quite exciting. So thank you all for joining. I'm just going to say a little bit because I don't want to take away too much more of Maha's time, but Statistics Canada, we work in an analytic and research division. We are very much interested in engaging with stakeholders, and academic partnerships are really a very important part of what we do because we're a scientific division. We do a lot of scientific activities. We publish in peer-reviewed journals. We collaborate on grants. And there's nothing we like more than helping people figure out how they could answer some of their population-based research questions with data holdings that we have at Statistics Canada. And you might be familiar with, the National Longitudinal Survey of Children and Youth, or the Canadian Health Survey for Children and Youth, or some of those other survey vehicles. But the more recent, really exciting opportunities are around administrative data and linked data, particularly for children and youth. And like Astrid said, completely underutilized, particularly when we talk about, the most vulnerable groups. And of course, our data can't answer all the questions in the way that people might want them answered, but they really serve as a really good complement to other studies that are being done, especially for clinical studies. So if you feel like you don't know where to start, or you wouldn't even know how your research question could be addressed, we are here to try to help build those bridges, have the conversations, and to encourage that. So yeah, I'm not going to talk anymore. I know we're going to have subsequent presentations where we could go more in depth into the different specific type of data sources we've got, or more specific examples of projects. But I'll just leave it at that. And if anybody has any further questions, I'd be happy to address them at the end. Thank you.
Great. Thanks, Daphne. Leanne, did you want to say a few words as well? No.
No, I think Daphne more than covered it. So I'll turn it over to you to turn it over to Maha.
That sounds great. All right, so I will just very quickly introduce Maha Clarke, who works in the Social Data Linkage Environment, SDLE, in the Centre for Data Integration and Development. She's been with StatCan for the past 20 years, and in that time has worked in several areas on both business and social surveys. And then for the last 6 years, she's been working in the SDLE and focused on record linkage projects, data integration and analysis. So with that, thank you very much, Maha, for presenting, and pass it on to you.
Thank you, Astrid, for the introduction. I'll share my presentation now. Just give me 1 second. I'm not sure if it's actually sharing, so.
Not yet.
Okay.
It's usually you see the red.
Yeah, I'm not sure why it's, hopefully we'll figure it out quickly.
Can you try again, Maha?
Yeah, I am trying. I'm sorry about that. Okay, here we go. Can you see the presentation now?
I still see your document folder.
Oh, oops. I have the presentation up, so I don't know why it's not sharing it. My apologies, I'll try again.
There it is.
You can see it now? Okay, perfect. So again, thank you all for attending. My name is Maha Clarke. I work in the social data linkage environment. I've been working in SDLE for almost 6 years, and I'm currently the unit head for the data analysis unit. And my chief, Chantal Poirier, is attending as well, so she will be able to answer any technical questions you may have. So today I'll give you an overview of SDLE. I'll briefly talk about the different record linkage methods we use. I'll explain what the derived record depository is, and I'll go over a list of some of the linked data sets in SDLE. I'll talk about our products and services, and I'll show you how to initiate a record linkage project and then discuss feasibility, costing, linkage approvals, data acquisition. And then I have a few examples of child-based projects that we have worked on, and I'll just let you know what was done. So the social data linkage environment is a relatively innovative way of doing record linkages at Statistics Canada. We've been operating since 2015. And the social data linkage environment is a secure processing environment that facilitates the creation of linked population data sets for social analysis. SDLE offers a highly secure data infrastructure for record linkage activities. It increases efficiency through the use of processing system, therefore offering more timely results, and obviously the cost is significantly lower. SDLE enables linkages across multiple data sets in the social domain, which fills important data gaps and can contribute to new research and a better understanding of Canadian society. And here I have a link to our website. There's a lot of details and information there. So if you are interested in SDLE, I highly recommend that you check the website. The SDLE program is located in the Centre for Social Data Integration and Development at Statistics Canada, and is primarily funded through recovery of its costs from the sponsors of the record linkages. In SDLE, we have 3 separate units, and the processing environment team, the analysis and data development unit, and the methodology team. And the reason that these sections are separated is to ensure confidentiality. So the processing environment has access to personal identifiers only. By personal identifiers, I mean names, dates of birth, addresses, any information that would be used for the linkage itself. The data environment has access to the keys that allow us to match records to the analytical files. So the processing environment is responsible for preparing different data files for record linkage. They maintain and build the derived record depository and the key registry. And I'll talk about the derived record depository and key registry in more detail later on. And the analysis and data development team is responsible for client services and data integration. So if you're interested in initiating record linkage project, you would contact the analysis and data development team. And they would be also responsible for producing linkage output files and documentation. The methodology team is responsible for developing the best linkage strategy and conducting the record linkage itself. SDLE has modernized record linkage in the social domain by linking files once and reusing the linkage results. So one of the main advantages of the SDLE is that the linkage results are retained and can be reused for other approved record linkage projects. So once a file is linked, it can be used by any other project without the need to redo the linkage. This means that the turnaround time for such projects is shorter, and it always has an impact on the cost as well. I would say that a growing number of our record linkage projects now only require the creation of key files, which means linking 2 data files without needing to perform a new record linkage, because the files have already been linked in SDLE and the keys have been stored in our key registry. I also wanted to mention quickly that only the variables required to perform the linkage are brought into our environment. The analytical variables, anything about income, cause of death, etc., that is all kept separately. So now I'll talk quickly about the SDLE benefits. One of the benefits of SDLE is that it increases the relevance of existing Statistics Canada surveys. That includes maintaining the relevance of completed longitudinal surveys. We have linked many longitudinal surveys like the NLSCY, SLID, and NPHS. SDLE also increases the use of administrative data. It generates new information without additional data collection. It maintains the highest privacy and data security standards, and it promotes a standardized approach to record linkage processes and methods. So before, different teams at Statistics Canada were conducting record linkages using different methods and standards. SDLE consolidated this expertise for social domain record linkages and created standard products and processes that can be applied consistently. SDLE also helps reduce the cost of linkage projects. The SDLE process surrounding the preparation and management of files for record linkage is made efficient and timely because of systemization. Also, all the files brought into the environment are processed and linked only once, like I mentioned before. Updates to the administrative data files are linked on an ongoing basis as part of the SDLE production. So anything like tax data or immigration data is updated annually. The resulting linked data can be used for any project with approval, of course, and can be used to update linked analysis file with more recent data, such as tax filings, can be linked to vital statistic death records, for example. So the main benefit is that we update the linkage once, and the results can be reused to update many linked analytical files. SDLE also helps fill data gaps. Studies produced through SDLE have the potential to address important information gaps in the analysis of social data, including health, education, income, or justice. So comparative pan-Canadian research is made possible with the establishment of a comprehensive and standardized data infrastructure that makes better use of socio-demographic information and in administrative data files. SDLE also helps reduce response burden. An additional benefit on survey respondents would be that we would reuse information that is already collected. So a common example would be to replace income questions on surveys with administrative data on income. So this would eliminate the need to ask respondents for their income information. Also, the quality of linkage is systematically measured. For each linkage, we calculate the linkage rate, which means the proportion that the cohort members linked in our environment. We also calculate the false positive and false negative rates. And this information is reported in the record linkage reports, which are prepared for every record linkage that we conduct. The SDLE is a highly secure environment that facilitates the creation of linked population data files for social analysis. It is important to highlight that it is not an integrated database of survey information about individuals. At the core of the SDLE is the Derived Record Depository, which is essentially a national dynamic relational database containing only basic personal identifiers. And the DRD is created by linking selected Statistics Canada data sets for the purpose of producing a list of unique individuals. And these files are brought into the environment, processed, and linked only once to the DRD. We also have strong governance and adherence to policy and privacy, and we offer a suite of tools for analysis and external researchers conducting record linkage activities within the social domain. Linked analysis files are deemed sensitive statistical information and subject to the confidentiality requirements of the Statistics Act. So to reduce the risk of privacy, intrusiveness, and to minimize the risk of disclosure, source files in SDLE are separated into source index files and source data files. So as I mentioned before, the record linkage production environment that uses source index files is separated from the data integration and analysis environment that uses the source data. So Statistics Canada employees performing the record linkages in SDLE only have access to the basic personal identifiers required for linkage. And employees who build the analytical files for research have access only to the data, but it is stripped of any personal identifiers. Therefore, anonymous keys are used to integrate the data from the various sources into a linked analysis data file, and only Statistics Canada employees who have an approved need for access to the data for their analytical work are allowed access to the linked analysis files. There was also a privacy impact assessment that was conducted by Statistics Canada when SDLE, the SDLE program was initiated, and they found that these processes are acceptable to reduce the risk of privacy intrusiveness and to minimize the risk of disclosure. Now I'll talk very quickly about the two main types of record linkages that we use at Statistics Canada. So to start, I'll give you a very quick definition of what record linkage is. And record linkage is the combining of two or more micro records with information about the same entity to form a composite record. And we use two types of record linkage methods, the deterministic and the probabilistic linkage method. We use the deterministic record linkage method when direct identifiers are available. By direct identifiers, I mean variables such as health insurance numbers or HINs. So if the HINs are available, we would use the HIN to match to other data sets containing HINs. But even if we do not have a unique identifier, such as HINs, a methodologist may use the deterministic method by creating a pseudo key. A pseudo key is typically created by concatenating different personal identifiers, like first name, last name, date of birth, sex, and postal code. This pseudo key is then used to find records belonging to the same entity. And this is done usually when we have very few linking variables, and any variation between similar values would introduce large amounts of error. Probabilistic record linkage method, on the other hand, is used when unique identifiers are not available, and the personal identifiers may have errors or variations. So for example, on some administrative data files, you would have the first name on one record, but you could have a nickname on the other file. And there could be entry errors. We see a lot of errors in dates of birth. The day may not be accurate. So when there are variations in the personal identifiers, we use the G-Link software. A G-Link compares all items in common between the two files, and it assigns a matching weight for each item. The total weight represents the likelihood that the two records belong to the same person. In the end, the choice of record linkage method used is based on the availability of the linkage variables and the quality of these variables. So here we have a visual that represents SDLE. SDLE facilitates the linkage of person-level data. So that is at the center, it's the person-level data. And the data may come from either administrative data sources or from surveys. And you can see that in the large circle. These data sources encompass the entire social domain and include data on education, labor, health, justice, and vital statistics. And these are the smaller circles. It achieves this in a two-step process. first by linking the administrative and survey files to the derived record depository and storing the keys in a key registry. The stored keys can later be used to bring together analytical data for any approved project. And some of the source index files used to build the DRD include tax, vital statistics, registration records, and immigration data. And updates to these data files are linked to the DRD on an annual basis or ongoing basis, whatever the cycles are for these specific data sets. Again, only basic personal identifiers are stored in the DRD. Examples of personal identifiers include surnames, given names, dates of birth, sex, parents' names, marital status, addresses, postal codes, phone numbers, immigration date, and date of birth and death. We have, I just wanted to highlight what the definitions again are for the derived record depository and the key registry. We have mentioned them before, but I just wanted to make sure you have a clear understanding of it. So the DRD is a historical database of Canadians that we have built using administrative data for each individual, and a specific SDLE group ID number is assigned to each individual. All source files are linked to the DRD either probabilistically using a G-link or deterministically, like we mentioned before. And when we do deterministic linkage instead of G-link, we use SAS scripts and programs. And these personal identifiers and source index files, record IDs, are linked, are stored in the key registry. And the key registry is a secure vault that stores associated record identifiers from all survey and administrative data files linked to the DRD. So once a study requiring linkage has been approved and the required files have been linked to the DRD, the key registry identifiers are extracted from the environment and are used outside of that environment to get the analytical variables required to build the study files. Because the DRD is a historical database, it is now so large. It covers over, I think, 65 million records at this point. And we have hundreds of millions of records about different information for different addresses, etc. The DRD only contains information required for the linkage, doesn't include analytical variables. I can't highlight that enough. Some of the contributor sources to the DRD are the T1 personal master file, and currently we have linked data from 1981 to 2019. We have also linked the Canadian Child Tax Benefit, the Canadian Birth Database, Canadian Mortality Database, and the Landed Immigrant File. I wanted to mention also that when you are proposing a new record linkage project, we do not recommend that you link a sample to a sample survey to another sample survey. We recommend that if you have your own cohort and you're linking a sample, that you link it to one of the administrative data sets linked here, because then the coverage would be greater. I also wanted to mention some of the health data sets that we have linked to the DRD. We have the Canadian Cancer Registry, Discharge Abstract Database. There's a long list, NACRS, OMERS. We have the CCHS linked. We have Vital Statistics, Birth and Death. And we have also linked a mother-centric file that has linked the information of the mother for each birth record. For a complete list of the data sets that we have linked in SDLE, you can refer to our website, and we update this on a regular basis. So it would be a comprehensive list of what is available. So I would just like to note that some of these linkages serve a dual purpose. We can update and provide new information to the DRD while creating linkage keys. So for example, the DAD, NACRS, OMERS, hospital data linkages provide us with hints for the DRD that can be used to link other data files containing hints. But they also create linkage keys to link data on interactions with the Canadian healthcare system with the other files. For SDLE products, we provide three main products, which are linked key files, linked outcome files, and linked analysis files. Key files can be used when the analytical data sets are available in the RDCs. So we would provide you with the unique survey identifier for each data set, and you would be able to retrieve the analytical values, variables from the RDCs. Outcome files contain selected analytical values for the target file, and linked analysis files contain the selected analytical variables for both the cohort and your target file. And all products that we produce, or all files, are typically accessed at the RDCs. Now I'll go over some of the services that we provide in SDLE. One of the main things we do is assess the feasibility of a record linkage project. So we receive proposals, and then we decide if it is possible to link those files. We offer advice on data sources. So typically when we receive a proposal, we meet with the clients to try and better understand their data needs. And we may even suggest other files that they could link to that would help their research. We also liaise with subject matter area experts. We assist with all the approval steps. Obviously, we conduct the record linkage, and we build custom linked analysis files according to the client's specifications. We also advise on analytical limitations on validation, and we provide training and outreach. So if you are interested in a record linkage project, the first step would be to complete an SDLE proposal form. And we have to have this form completed in order to assess the feasibility of the study and to determine timelines and the cost for conducting the record linkage. In the SDLE proposal form, we collect information about the objective of the proposed study. We also would like you to highlight the benefit, the public benefit to Canadians, because this information would be useful when we prepare the approval process, when we start the approval process. And we also require a list of the files that you would like to be linked. And if you are sending us a new data set that we don't currently have at StatCan, we ask you to list the identifiers, the personal identifiers that are available for each data set. So once we review the SDLE proposal form, we determine if it is feasible to complete the linkage. At a minimum, I would say that we need the following personal identifiers in order to complete a probabilistic linkage. So we require a first name, last name, date of birth, not age, that isn't very helpful. So we need the actual date of birth, the gender, and the postal code. Then once we determine that it is feasible to proceed with the project, we prepare a cost estimate for the request. And SDLE is a cost recovery program. So each project is unique and a range of outputs are available. And the cost reflects the requirements of each client and the range depending on the complexity of the proposal. Also, if SDLE is sending you directly cost estimate, please keep in mind that that does not include the RDC access cost. Also, there may be some costs associated with the staging of the files. So once we prepare the files, we send them to the RDC program, and they have to stage them in a way before they make them available to researchers. Also, since subject matter areas are involved in the projects, they may have additional costs for validating the data results or doing their own analysis. I would also like to mention that the size of the file doesn't really have a major impact on the overall cost. So if you have a data file with 1 million records or 5 million records, it doesn't really change the work that we have to do. It just takes a bit longer to run. Now we'll talk about approvals, and which is a very important step in record linkage projects. All linkage projects at Statistics Canada have to be approved by the chief statistician. And once approved, a notification is published on the StatCan website. Also, subject matter areas at Statistics Canada have to review the linkage proposal and consent to their data being linked. So if you are requesting to link to tax data, your proposal would have to be sent to the Income Statistics Division. They would evaluate it and basically agree to allowing the tax data to be linked to your data set. The approval process can take several months, so we recommend contacting us early in the process because we have to go through different stages of approval before the final proposal is sent to the chief statistician. If you are sending us a data set that you would like to link in our environment, you would have to go through the data acquisition process. And what we require is some kind of documentation or proof that you have the authority to link the data set. That is more, that has more to do with our legal department. So if you are sending us a data set, they would provide you with more information about the type of proof they require before we can proceed with linking the file. And we have two authorities that we can bring in data sets under, Section 13 and a Section 3. For Section 13, that would mean that the data can be accessed by other researchers at the RDCs. That would require minister approval, and the data set becomes StatCan property. On the other hand, the Section 3 is if you have a smaller data set that you simply need linked to evaluate your own program, and that would only allow authorized researchers to access the file, and minister approval would not be required. So in order to determine whether the data set will come in under a Section 3 or a Section 13 is totally dependent on the type of file and whether it will be beneficial to other researchers and Canadians in general. So if you're looking to send us the SERP file, for example, that would be beneficial to everyone, and we would bring it in under a Section 13 so it becomes available to all other researchers. Here I have a few examples of child-based projects, linkage projects that we have worked on. For example, we worked on the Extending the Relevance project where we linked longitudinal data sets. So we linked the National Longitudinal Survey of Children and Youth and the Youth in Transition surveys to obtain their educational and income outcomes over the years after collection for these surveys has ceased. So, and this year we're currently in the process of linking NLCY and YITS also to health data. So they will be linked to DAD, NACRS, and OMERS. There was another project we worked on, which is the impact of preterm birth on socioeconomic, on educational outcomes of children and families. And that data set was linked to tax, death, EI status vector, and educational data sets. And the purpose was to study the short and long-term educational and socio-demographic impact on preterm birth on Canadian children and their families. We have also linked the survey on early learning and child care arrangements, SELCA. And we linked to tax in order to obtain spousal income, household income. We were also able to retrieve the total number of children and the postal codes of respondents. As I mentioned before, we have a website that we encourage you to check out. It has a lot of details about SDLE, and it also has our email address. So if you're interested in initiating a project, you could simply email us and we would send you a copy of the SDLE proposal form, which you can return to us. And that's basically it. I'd be happy to